Good evening and welcome to my How Healthy Are You weekly conference call. My name is Dr. Thomas Brewer. I'm a PhD chemist. And since there's nothing else going on in the country and the world other than talk about coronavirus, COVID-19, I'm going to talk a bit about it. This is information you are not seeing in the news. So I suggest you pass this information along to family and friends. After I finish this coronavirus information, I'm going to talk a bit about the circulatory system and varicose veins, but it seems like the only interest now is this virus. So one question I get is, can I see viruses under the microscope? It depends, but this virus, yes, I can. The size of this virus is 500 nanometers. And since I have a magnification on my microscope of 1,000, that means I can see something. In this case, it would be 500 microns. So absolutely, positively, I can see this virus, and I have seen viruses under the microscope. But now when I tell people I see a virus, they all get really scared because they think there's something special about this virus. So let me tell you what's really special and what isn't so special. So coronavirus is a classification of viruses. If you remember, I'm going to read to you what I wrote in the January 13th newsletter, way before you read much about this at all. And here is what I said. It was just reported that a new coronavirus has shown human-to-human transmission in China and other countries. Coronavirus is a family of viruses that cause infections ranging from colds and pneumonia all the way up to SARS. The World Health Organization is now preparing for a wider outbreak. Boy, is that did that really happen? My advice is to continue taking 3 Steromax per day about 30 minutes before your first meal of the day. Your only defense from this and other viruses is your immune system white blood cells. So this is something that does not get any press, and that is nobody is talking about your immune system fighting off any virus. So most people don't even get the flu every year. And the news media isn't mentioning anything about the reason people don't catch the standard flu known as influenza. It's because they have a strong immune system. That's something we can see under the microscope by just looking at the size and movement of the white blood cells. Right now, the news media is wording their facts as if everyone is going to get this coronavirus, COVID-19, as long as they're exposed. And that's not the case because you don't catch other forms of the flu if you're exposed. Just because there isn't a vaccine doesn't mean you're not going to get it. So they're trying to persuade you to think that everyone is going to get this if they don't have a vaccine. That's not true because most people don't get influenza without taking the flu shot. It's just a matter of your own immune system protecting you. Now, the best way to do that is to take your Steromax, 3 capsules a day, about 30 minutes before breakfast, or any time you have an empty stomach, because we want to get those white blood cells strong and active. Now, normal influenza, the normal flu, kills 0.1% of the people that contract it. So first, everybody doesn't get the flu, and 0.1% of the people that get the flu, 0.1% die. These are the weak. These are people with weakened immune systems. They usually have other problems, and the final straw was the flu. But this hasn't been noticed. This does not get any attention. Nobody has even cared that people die from standard influenza. Well, this special virus, this COVID-19, a type of coronavirus, has a death rate or a kill rate of around 0.5%. You're going to see numbers that it's 1% or 2%, but again, they're just looking at the early numbers. These are people that were weak and that caught it and died. I mentioned earlier in a previous conference call that you're going to see these numbers go down to 0.5%. Still, the news will say this virus kills 5 times more people than the standard flu. Okay, true statement, but that would still be 0.5% of the people that get it. And again, the assumption is everybody's going to get this. That is not true. Everyone may be exposed to it, just like most all of us are exposed to standard influenza. And I am sure we've all been exposed to other types of coronavirus, just not this particular COVID-19. And we're still alive and kicking. If your immune system is strong, you don't get it. But that being said, there is a way for you to protect yourself, your family, your clothing, your heating system, etc. Those details will be in the newsletter that comes out tomorrow. One version of that is to use a spray bottle with colloidal silver. Some of you have received a newsletter about that. I'll go into more detail in my newsletter, and also using a humidifier or mister with the colloidal silver. So I will detail how to protect your house and essentially make it your sanctuary. And that's what people want. They want a place of protection. So in China, this virus has peaked, and they're starting to see a decrease in cases now. That's because it started quickly there. And so we're looking at a few months of problems before it starts decreasing in the U.S. What I see happening is once we start having a decrease in cases as the weather warms, and combined with the fact that people are just going to get pissed off that their freedoms are being infringed upon, you'll see life starting to get back to normal. But the news media is creating a lot of hysteria. It's completely unnecessary. They'll find a few so-called experts that mention that we should be cautious, and then the news media just looks at those words and nothing else. So take your Sterimax. If you haven't been taking it, take it. But if you want to protect your family and your house, all your surfaces, so that your house is clean, that can be best done with the colloidal silver, because that's immediate. You don't have to wait for your immune system to strengthen. You can deal with it with colloidal silver. A little bit of basic information about viruses. Again, viruses are not considered living organisms. They essentially become a living organism once they attach to a host. But the cells that make up a virus are alive. That's what makes it kind of confusing. So you can kill the cells that make up the virus. That's what the colloidal silver does. Technically, you can't kill a virus because it wasn't alive to begin with. But when people talk about killing a virus, that's really what they mean. They probably just don't know that a virus isn't alive. So what they mean to say is something is killing the cells that make up the virus. So when I do blood microscopies, I do tell people if they have viruses and fungus and parasitic bacteria in their blood. And I can see from this point forward, everyone's going to be interested if there's a virus in their blood, because we have a lot of hysteria. Okay, so that was the first part. Now, Sandra wanted me to mention about the circulatory system, more specifically varicose veins. This is a real interesting topic. The circulatory system is just simply your heart, your blood vessels, and your blood. So it really ties into the blood microscopy, because that's what I do, is I look at blood under a microscope. Now, there isn't much more to say about the circulatory system, but there is something to say about varicose veins. And varicose veins, they typically look blue, but that's just because of the way the light's scattering through your skin. But they bulge, and they're due to faulty valves in your veins. So the blood has to get from your heart to all the systems in your body, and then back to the heart. And if there's any faulty valve system, then the blood will pool, and that's what causes the varicose veins. Faulty valves leads to pooling blood. This is very common. 23% of adults have varicose veins. So what do you do? Well, since it's caused by excess pressure, which is typically when one is pregnant, that's why it's common in women, or obesity, or standing too long. Anytime there's excess pressure in a part of our body, but standing is a big one, you can get varicose veins. The solution is really simple. The solution is you stop the pooling of blood by exercising. That's the best way to get rid of varicose veins. You move, you walk, you do some sort of simple movement, some simple exercise, whatever you can handle, all the way up to more advanced forms of exercise. But moving, you've got to get moving. Diet-wise, back to the plant-based foods. Plant-based foods tend to be best to fight varicose veins. So the problem that we don't want if one has varicose veins is we don't want it to get worse, and eventually you'll have a blood clot, and that's a bad thing. So enzymes are absolutely the best way to keep your blood nice and clean and able to flow to prevent blood clots. So it's a nice, clean way to prevent blood clots without thinning your blood so much that you bleed out with a blood thinner. Some people think massage gets rid of varicose veins. It actually doesn't, but it helps get rid of the pain. But it really doesn't get rid of the varicose vein. Supplement-wise, your best supplement is going to be the Aloe Ace Max. Because it's a cell regenerator, it will give your cells an opportunity to heal themselves, and that's what Aloe Ace Max does. It's good for arthritis, diabetes, and anytime you want to regenerate cells, since it's a cell regenerator. So in this case, it'll help you regenerate the cells that make up your veins. Okay, so that's what I had on the circulatory system. Talked a bit about coronavirus COVID-19, and in the newsletter I'll go into a lot of detail on what to do with the colloidal silver. All right, so I'm going to come off lecture mode and open up the call to questions. Are there any questions for this evening's call?
A question about the Aloe Ace Max.
Yeah.
would that be good for someone who has just had surgery? Is that good to? Okay.
Absolutely. I recommend taking Aloe Max after surgery. Before surgery, don't take anything. Don't take any enzymes. Don't take anything. But after surgery, yes, take your Aloe Max. Are you there, Sandra?
Yes. And other things that you would recommend after a surgery? My friend had bladder cancer surgery last week.
Right.
So that's what.
So you'll want to get keep those white blood cells strong with the Steromax. You'll want to digest very efficiently so that there isn't any stress on the body or inflammation. So take enzymes with the meals. So that would be the best thing. Without looking at the blood, sometimes hospitals have a lot of bacteria, and people end up getting bacteria in their body. So it wouldn't hurt to wipe the wound with colloidal silver twice a day. Just put some on a gauze pad. That will kill any bacteria around the wound. And if you suspect that you've been compromised with bacteria, you can always take half an ounce of the colloidal silver twice a day on an empty stomach for just a few days, just to kill any bacteria that could have gotten into your system. After taking colloidal silver orally, you always want to follow it up with probiotics. And probiotics would be another good thing so that your body doesn't let the parasitic bacteria into your blood, but they just stay in your gut. That's what we want. We want all the bacteria to stay in our gut and our small intestine, large intestine, and colon. We don't want this bacteria in our bloodstream.
Okay. Thank you so much.
Okay. We just have a few people on the call this evening. Are there any other questions? Okay, I'm going to end the call. As always, this call has been recorded, so you'll get a copy of this in the newsletter, and I encourage you to pass it forward. Okay, so stay healthy, and I wish everyone a safe and healthy evening. And until next week, good night, everybody.
Night. Thank you.
Okay.